Lifestyle medicine. Sure, that makes perfect sense. Our lifestyles are obviously central, critical to a healthy life. And yet, as strange as it may sound, the concept of lifestyle medicine first came to the forefront in 1989, adding behavioral, motivational, and environmental skills to conventional medical practices. Today, we have the unique opportunity to tap into the insights of one of the pioneers in lifestyle medicine, Harvard Medical School's Dr. Beth Frates. Welcome to the latest episode of the Catalyst 360 podcast, your trusted resource for engaging, evidence-based health, wellness, and performance insights. I'm your host, Dr. Brad Cooper of Catalyst Coaching 360, and I've been looking forward to this discussion. One Dr. Frates and I have been working to get on the calendar for over a year. In addition to being a pioneer in lifestyle medical education, she is also an award-winning instructor at Harvard Medical School, and she continues working one-on-one with individual patients in her clinical practice. On the subject of lifestyle medicine, if you've been considering pursuing your MBHWSC-approved health and wellness coach certification, our next cohort is just around the corner. If you'd like to discuss questions about how it might fit into your current or future career plans, details about the process, or anything else, please reach out anytime. 720-339-4292. That's 720-339-4292. Or you can email us anytime, results@catalystcoaching360.com. And if you're an employer, EAP, or maybe a wellness provider looking to support or enhance the physical, emotional, and mental health of those you serve, Catalyst Coaching 360, well, it might just be the solution you're seeking. Personalized, best-in-class, and value-based health and wellness coaching that you can integrate into any program, any platform. We do one thing, coaching. It's in our DNA. If you're tired of settling, maybe it's time for a catalyst. CatalystCoaching360.com is the website, or send us an email, results@CatalystCoaching360.com. And now it's time to put the lifestyle back into lifestyle medicine with Dr. Beth Frates on the latest episode of the Catalyst 360 podcast. Dr. Frates, we worked hard to get this one on the calendar. Welcome to the show.
Thank you so much for having me, Brad.
We talk about pioneer. We have fortunately, a lot of pioneers on this show, but you're a pioneer in this growing area of lifestyle medicine, which is so apropos for our listeners. For those who may not know that phrase, how does that differ from traditional medicine? And why might someone want to seek out a physician with expertise in that area?
That's a great question, Brad, and one that's on the mind of a lot of people. First of all, we have the American College of Lifestyle Medicine, which has physicians, nurses, health coaches, social workers, physical therapists, psychologists, a number of different healthcare providers in the organization, because lifestyle medicine is a team sport. So I come from this in the physiatry world, where we have the physiatrist, physical therapist, right, occupational therapist, speech therapist. And it's a little similar in lifestyle medicine. So we are growing and burgeoning in this really exciting space, which is using the 6 pillars of lifestyle medicine to help patients prevent, treat, and in some cases reverse chronic conditions like high blood pressure, diabetes, coronary artery disease, obesity. What are these 6 pillars? Physical activity, nutrition, sleep, stress resiliency, social connection, and avoidance of risky substances. These are our 6 pillars that lifestyle medicine specialists, so physicians that have been board certified in lifestyle medicine from the American Board of Lifestyle Medicine, as well as other healthcare professionals that can be boarded in lifestyle medicine by the American College of Lifestyle Medicine. How does this differ from traditional medicine? So the physicians that have gone through medical school, taken step 1, step 2, gotten through their licensing and procedures, and then been board certified in their own specialty, could be cardiology, could be internal medicine, family medicine, endocrinology, some radiologists. They then get double boarded in lifestyle medicine. So, for example, those cardiologists that are treating sick patients that have heart disease, some will require medication, and that physician will utilize medication. A lifestyle medicine boarded physician will be very comfortable thinking about how to prescribe sleep, how to prescribe stress resiliency, exercise, nutrition, and the other pillars to this patient. So the traditional physician still does rely upon diuretics for congestive heart failure. Why? Because diuretics are what will release the fluid from the system because the heart isn't pumping well enough. And now exercise and stress reduction can't help the muscle pump well enough to then create a diuresis. So pneumonia, we need the antibiotics. Asthma attack. There are things where the traditional physician is going to rely on traditional medications to treat a patient. When it comes to behavior change and chronic conditions, we want to think long and hard about the patient's lifestyle. Individually, what's going on in their own heads, what's going on in their own bodies, but then we must also go, what's going on in the work environment? What's going on in their neighborhood? Is there even a store around them that sells fresh produce?
Right.
Are they safe to take a walk outside? So we must go to the environment. Then we must even go to the state and the state laws, the country laws. We can't just think about the individual. Although with coaching, as you know, I'm also a certified coach. With coaching, we are working one-on-one a lot with the individual. But we do the social ecological model of change. We look at these circles around people. And a lot of what I'm doing is trying to help people in groups. Why? One of the pillars is social connection. So when we work in groups, we create community. We allow for some of the wisdom in the room to heal others in the room. Now, I will give you the medical background. I will give you the research. I will give you the data on these things. I will share that if you're sleep deprived for 5 nights, you only get 4 hours of sleep, your insulin sensitivity is going to reduce 24%. I can share with the group some medical data, which will make you think, oh, so for diabetes, sleep is actually important too, which it is.
Huge.
But what I want to say is we have to think about communities and creating communities of healthy minded, healthy catalysts, using your term, healthy catalysts that will help move each individual as well as their environment and community forward towards thriving, optimal well-being.
So what I love most about this is you're not coming at it. The reason we started the podcast in the first place is there's so much baloney in health and wellness, and it's sad. And you're coming at it from the medical science side. You're not throwing that out. You're not saying, hey, I found this one case study, so I'm going to tell 1,000 people about it. You're saying, here's what the data shows. And in addition, we're going to address these other areas. And it's interesting, you're 6, and we're going to take each one of them one at a time. So have some fun with that. But we call the Catalyst Cornerstones move, fuel, rest, and connect. So there's a big overlap between our 4, move, fuel, rest, connect. You've added to that. You've built in stress as a separate category, not you specifically, but the ACLM,
right.
And then the goal setting piece as well in that. But it's interesting to see that overlap. Talk to us a little bit about, I don't know, is there pushback from the medical community that says, I don't have time, Beth? Like I've got 6 minutes per patient, and I don't disagree with you. Of course, I think lifestyle is important. Of course, I think we need to help people change their behavior, but I've got 6 minutes. And what are you hearing on that realm? You're right in the midst with Harvard. I know you do a lot of lectures on board in addition to your teaching there, but what's the feedback you're getting from your peers with this?
So, Brad, it's fascinating. And I've been in this since 2007 or 8, as you know, so for a long time. And I'll tell you the barriers. So the first barriers that the medical community will put up is, one, we don't get this in medical school. We don't get nutrition training. Yep. We don't get exercise prescription, sleep hygiene or prescription. social connection and how you cultivate a high quality connection. It's not taught in medical school. So one is lack of confidence because I haven't been trained in it, haven't taught it. But you went to the all important time one. I don't have the time. That is true. And some of the problems with implementing lifestyle medicine are not with the practitioners, but with the system and the EMR and the reimbursement. So that's a
EMR is medical records. Is that?
Yeah, electronic medical records. That's a whole other story. But let's go with what we have now. We are hoping to transform healthcare, but that will take some time.
Sure.
So where are we right now? Where we have 6 minutes. If you come to American College of Lifestyle Medicine conference, you learn about the pillars. So we're going to fill the gap in, and then we're going to talk about coach approach and coaching conversations where you can have a collaborative, negotiating type of conversation, ask even an open-ended question, which allows the patient to really reflect and think to themselves how they want to proceed. Even in a 6-minute visit, you could ask one open-ended question that could help us on this journey. So once you learn the information, feel a little more confident about this coach approach, this coach style, that sets you up for success. You still have to practice, but one of the best things we can do is institute assessment scales. So in many places in the EMR, the electronic medical record, the patient is asked, how many minutes are you exercising in the week? How much are you sleeping? Are you food secure? But they don't ask it that way.
Right.
Do you have trouble making it paycheck to paycheck to put food on your table? So we are getting to this place where in the routine annual visit for a patient, there will be some questions in these categories that will even just asking the question makes the patient think, oh, the doctor's office is asking about my movement, my physical activity. Sure, they're asking about cigarettes again, and they're asking about alcohol, which we need to do. But look what else they're asking me about. And by the way, loneliness. Do you feel lonely? Are you socially connected? It's a very important pillar. And so if we just ask those questions, the one that is getting in there as a vital sign, we call those the lifestyle medicine vital signs. We're getting that physical activity one in more and more to be acknowledged and utilized. Another would be how many vegetables do you consume in the day? How many servings do you consume in the day on average? Why that question? Well, it really does tell you a lot about someone's diet, because if they say 0, that tells you a lot. If they say 8, you know where they are in terms of overall meal planning, because it takes a lot to get 8 servings of vegetable into a day. They are likely cooking at home, batch cooking, and really planning it out. So,
well, and like you said, just asking that question, because physicians are so respected in our world, especially in the U.S., for our U.S. listeners, just the fact that you asked me, I walk away going, well, Dr. Frates, she's curious about my veggie. Maybe I need to do a little bit more. So I like the way that just the question, regardless of where the conversation goes, because the respect that you hold as a physician, it drives that kind of intrinsic motivational consideration, if you will.
Right. And what we want to do in lifestyle medicine, when we talk about behavior change and coaching, we want to introduce the physician to the fact that the patient is the expert in their life.
Boom. Coaches, you're loving that phrase, aren't you?
And that we as a physician may be the expert. As I say, I was telling you some data that I love, and it's very interesting to me, and I'm trained in this, and I want to share it. But I may not just throw that out to the patient. I may say, oh, sleep, you're not sleeping well, and you do have prediabetes. I read an interesting article. Would you like to hear about it? And again, one day I will no longer be able to say this, but whenever I come at a situation with that tone, with that genuine care, with that question, giving them the choice, the autonomy, they say yes, because it is interesting. It is actually interesting to them because they do have diabetes and they are not sleeping. Right. Now, I'm not going to tell a patient who's worried about their breast cancer about this insulin sensitivity data. That's just not going to be useful, or mammograms to the diabetic that's struggling with their blood glucose, even if it's a woman that needs a mammogram. Sure. You have to. So we try to help.
It's not a script.
Right. We try to help the physician to understand there's a new way of being.
Right. Do you see the vital signs questions working their way in some format realistically, or do you think that's a pipe dream?
No, I do think that they will get in there. I'm not an expert in the EMR, electronic medical record, or reimbursement. I'm not. But I have many friends that are. And I believe that we will get there, yes. Because, Brad, we have a diabetes epidemic, obesity epidemic, dementia epidemic. We have many chronic conditions that people are managing day to day that are influenced by movement, food, sleep. We are seeing the medical community embracing and understanding the power of these pillars. One such example is the American Heart Association, who had Essential 7 for many, many years. So reduce blood pressure, eat a healthy diet, exercise, manage cholesterol. So they had an Essential 7. In April 2022, they added sleep. That's
interesting.
That's making them have an Essential 8. So the data is so strong in these lifestyle medicine pillars that, yes, large communities, large organizations, large medical bodies like the American Heart Association are seeing the importance. And fortunately, they have big voices and they can really hit a lot of people. So I'm so pleased, and it was a big relief to me when I read that sleep is now an Essential 8. And if you follow them on social media, American Heart Association, they do tweet about these important pillars of lifestyle medicine as well. And that says a lot. That wasn't happening years ago.
Yeah. Yeah. Good. You mentioned in a public lecture as I was preparing for this that well-being is not a destination, it's a process. It's a way of life. Talk us. I love that because too often we feel like, well, I'm not where that person is. I haven't hit that landmark, whatever it might be. It's different for all of us. That journey is different for all of us. What does this mean across the various decades of life? Maybe you could talk through, and we don't need to go every 20, 30, 40, but if you could maybe hit the 20s and then maybe jump to the 40s and then maybe the 60s, maybe we take kind of a 20-year pop here of what that looks like in terms of that journey.
Yes, I do like to emphasize that this is a journey. When I work with people one-on-one or in groups, they come and they're struggling. That's usually why someone would come to seek my counsel. And they usually want a solution. It's usually Mary's solution. They heard Mary talk to me.
Exactly, right.
Tell me they want exactly what Mary had, quote unquote. I'm just making Mary up.
Exactly.
And so this is part of the introduction to a lifestyle medicine process, which is that welcome to your journey. You've been on it. And thank you for including me at this point. And now I get to join with you as we take these next steps together for a while. May it be 6 weeks, may it be 12 weeks. You're always welcome to invite me back on your journey whenever you need. But this is a journey of a lifetime. I personally have been on this journey since I was 18 years old. I'm older than that now. And when I was 18, my dad had a heart attack and stroke, and he was paralyzed on his left side. So for me, this journey has been incredible, and it has changed with the science, as the science has changed. So when I was 18, we were in the 80s. This was a 1986 or something when he had his event. So what we learned then, just for example, with alcohol, it was you must start drinking red wine. Don, my dad, is what his physicians. He never drank before that, and he started drinking. And he was a very rigid guy, and he followed the rules. So he did his one glass of red wine. Fortunately, that worked for him. But nowadays, just interesting. Now it's 2023, and if he had the same event and saw his cardiologist today, the advice from the American Heart Association with all their research is, if you don't drink, don't start. If you do drink, 0 to 1 for a woman, 0 to 2 for a man. So just because that we learn every year, really every month, every day, but especially every decade, new things, new science, new understanding comes to light. And we do know now how closely tied alcohol is with cancer, that if you're thinking about cancer, there is no safe limit. Now that's January 2023 from the Lancet. So what I'm saying is, it's a journey. We have to be open to little shifts and changes in our journey. We need to have guides, though, right? Light posts. We want to have some organization that can lead us. So for me, Harvard Nutrition Source from the School of Public Health here at Harvard is my guiding light in nutrition. American College of Sports Medicine and ACE are guiding lights with physical activity. So there are guiding lights in lifestyle medicine, each of the pillars that we look to. But it isn't, okay, so I'm going to work with Beth, and let's just say, for example, with Mary, I'll lose 20 pounds and I'm all done. Now I'm set. Now here I go. I'm just going to go back to life as it is. Right. Wait, no. You made some changes. You started to enjoy life in a different way. And now we realize that there'll be even more changes moving forward. And who knows what in 2 years life will have in store. I didn't used to talk about forest bathing a decade ago. I talk a lot about it now because the literature is there. The recommendations to spend 120 minutes in the greenery of a forest or green spaces, if you can, each week. That's relatively new. I'm still on this journey. So that when you join this lifestyle medicine journey or well-being journey or wellness journey, whatever you do want to call it, this journey to lead you to a sense of vitality and thriving, you're constantly learning. It's lifelong learning is a big part of the journey. And being open to the literature and the research, and being open to exploration and investigation on your own. Try this. Hey, what happens when I don't watch TV at night? What do I miss? Do I really need that show? Whatever it may be.
Right.
If I just don't watch, what if instead I read a little, talk with my husband, and go to sleep, pet my dog a bit and go to sleep? What happens if I try that for a week? How's my sleep? I'm just making things up.
No. But that's exactly what we want to encourage people to do, because that N of one can be fun, because you're not forcing me to do it. You're saying, hey, well, what if you just pick something? Quick example, I'm forcing. I just haven't done a good job of it in the last 6 months. Getting outside in direct sunlight for 10 minutes every morning, and then tracking my sleep for 30 days. And we'll report back on what that looks like. But it's you're hearing it in the data. So what does that look like for this one individual? It doesn't mean it's true for everyone. But I think your TV example, the sunshine example, the forest bathing, I love that you mentioned that. We have one of our main speakers for the coaching retreat and symposium this fall is speaking on that subject. So thank you for teeing that up for us. I love this. And it kind of sounds to me, we use this little phrase, better than yesterday, a lot. And it kind of sounds to me like that's what you're sharing with your clients and people that are willing to listen to your message is we're not there. We're never there. We're trying to get better than yesterday, and then we'll shift, and then better than yesterday again. And we're moving in that direction. So I love that. Let's move in because I want to be cognizant of your time. Let's do a quick hit on each of the 6 areas. I'll just tee them up. I've got them written down here in front of me. And maybe, is there a surprise for our listeners? Now, obviously not to everyone, but is there something with physical activity is our first one. So is there something about physical activity where everybody knows we need activity in our lives, but is there something interesting that you've come across recently or you've discovered in your practice that people might go, oh, wow, I didn't know that. So let's just do each one of them and just whatever comes top of mind, and we'll just hit all 6 here in about a minute each, but something maybe off the beaten path with each one of these. So physical activity, any surprises in that one that people might go, huh?
I love this game. I can play this. I seriously can play this game all day. I wish you'd give me 10 for each 6 pillar. Okay, so I'll ask you, and if you say yes, then I'll move on.
Okay.
So you probably know your listeners, and so all right. So exercise. I have 4 in my head. The first one I'll try for you is BDNF. Do you know BDNF?
DNF?
Yeah.
BDNF. I don't.
Yeah, no, most people don't. Physicians don't. I give this lecture to multiple audiences throughout the country and now world, because I do it by Zoom. But I ask this, and the majority, it's very rare. Okay, let's do it. BDNF, brain-derived neurotrophic factor, a growth factor in your brain. Guess what? You know how you increase this? Exercise. What does BDNF do? A good friend of mine, Dr. John Rady, psychiatrist here at Harvard, he calls it miracle grow for the brain. What does that mean? Yes, it means that BDNF increases neurogenesis, increases the number of neurons you have in your brain. At Stanford, when I went to medical school back in the 90s, we thought you had a certain number of neurons and you needed to protect those. This is why I didn't want to drink. I didn't want to hit my head. I buckle your seatbelt, put on your bike helmet. You've got to protect these neurons. Well, I still do all of those things. I want to protect every neuron that I have, but I realized that when I exercise, I increase my BDNF, brain-derived neurotrophic factor, so I can increase my neurogenesis. And this is the last little, I can't help. I got to give you 2 here.
We'll take them.
But I mean, we could go on for hours, so I will move to the next one. But we'll also share the literature, which is at least 8 years old. And it shocks me that people don't know this. We haven't done a good job of marketing. When you exercise, you can change your brain. What? Yes. So there's the hippocampus in the limbic system deep within your brain that helps consolidate memories. Hippocampus. MRI studies show that with exercise, you can increase the volume of your hippocampus. You can help your memory. You also increase your insulin sensitivity. You can, okay, so there's so many things I could talk to you about with exercise, but boom, there's your new fact.
Well, and I was smiling as you were going through that because it reminds me of, and I wish I could say this was 40 years ago, but I bet it was less than 15 years ago. I was talking to a doc friend, and I enjoy endurance sports. So he was saying, you really want to do that stuff? And I was like, yeah. And he's like, I think you only have a certain number of heartbeats, and so I don't want to use them up. And I was just like, oh my gosh, what century are you in? But it's similar to what you're saying about the brain and protecting what you have versus the chance to grow it. The heartbeat, same thing. The more you use it or lose it kind of thing. So awesome start. Let's go to nutrition next.
Okay. Again, this could be 24 hours worth. All right. Let me ask you something. Do you know, how about short chain fatty acids?
Vaguely, but not enough to be wise on it.
Right. And so I'm using you. I'm sure you're very
perfect. That's perfect.
To your
Keep
listeners,
going.
and also to physicians. I'm asking you things that I ask physicians and generally get a no response to. That's why I'm asking them to you, because I've already tried this with big audiences. So I'm thinking of those questions that have gotten a no.
That's perfect.
So I'll start with fiber. And we'll get to short chain fatty acids because I can't help myself. I've been trying to just do one. So far, I can't help but give 2 or 3. Okay. So
I don't think anybody's complaining. We're good.
This would be very hard for me, but okay. Short chain fatty acids, it has everything to do with fiber. We are actually fiber deficient. as a nation. So WHO says that we need 25 to 29 grams of fiber. So when we think of fiber, I don't know what people are thinking right now. So I'm saying fiber. I would love to be inside people's brains, your listeners, your audience right now. And I just wonder what's coming into their head.
Right. When they hear that word.
Yeah. What do you think, your listeners, when I say fiber, what is coming to your listeners? What do you think?
I'm guessing they're thinking fruits and veggies, but I who knows?
Okay. I hope so. Terrific. Because other people are thinking Metamucil. I don't know.
Sure.
They're just thinking but I'm talking fruits, vegetables, and whole grains. These are all the ways that we get fiber into our bodies, into our systems, so that our microbiome can ferment them. That's the key. So you want your microbiome. First of all, you want a diverse microbiome. So you want multiple different plants, fruits, vegetables, legumes, whole grains, quinoa, right? Brown rice, typical whole grains. Okay. So this microbiome then gets a hold of the fiber and it ferments it into short chain fatty acids, butyrate, propionate, acetate, short chain fatty acids. That conversion from fiber into these short chain fatty acids lets the propionate, butyrate, acetate go into the L cell, part of our lining in our intestine, and then go in to have an impact on our metabolism. GLP-1, it impacts our lipid metabolism, our glucose metabolism, even our chances of getting cancer, all from the short chain fatty acids, which are created how? Intake fiber, microbiome, ferments them, creates the short chain fatty acids that allows the optimal functioning of our metabolism for how we manage sugar, glucose, how we manage lipids. So that's our cholesterol and our immune system. And then, of course, leading to, if we lead ourselves on the path or the environment directs us to the path of cancer or not. How much fiber we have can help reduce diabetes, colon cancer, heart disease, and stroke. So it is the short chain fatty acids. It's not just people are telling you to eat that apple. Apple a day keeps the doctor away. That's something, yes, we heard many, many times. Popeye and the spinach. Yes, yes. But now I want everyone to think, right, short chain fatty acids. That's it. That's the answer. Fiber, microbiome ferments it, creates short chain fatty acids, and off we go. And this is why, for decades, Dean Ornish and other pioneers in lifestyle medicine, they showed us in studies that there's multiple different ways to look at this, but for each additional serving of fruit and vegetable in the day, you can reduce your risk, something near and dear to my heart disease, by 4%. Have 5 servings. You've heard this. Try to go for 5 servings of fruit and veggies in the day. You reduce your risk of heart disease by a whopping 20%. So you know full well that if I had the vital sign before my doctor's visit that said, how many fruits and veggies are you getting? 8. Because why? I have a risk factor for heart disease. And why? What is she talking about? You probably heard. I mentioned my dad.
Your dad, yeah.
At 52. If your dad has a heart attack before 55 or your mom before 65, boom, you have a risk factor for life. That's your risk factor. Now, those are my genetics. You've heard many times, right? Genetics loads the gun. The environment, what we do, can pull the trigger, right? Lots of people have said that lots of different ways. I didn't make that up, but I remember it. Right. And I think about it a lot because I have the genetics set up to have a heart attack and a stroke, but I am not going to go that way. I'm going to go fighting. So I'm having those fruits and veggies for many, many reasons, but that's one. Okay, now we're only on the second pillar. All right.
You're killing it here. Well, and I think you must have peaked at the retreat agenda because Dr. Chris Lowry, you may know his work out of University of Colorado, his big thing is the microbiome diversity and he even talks about it's not so much the number of servings as the diversity, as you mentioned. So he'll have one blueberry. He'll have one little slice of cucumber. So that's not a full. Anyway, he's speaking too. So It's funny that you mentioned that. All right, let's jump into stress. I have some thoughts on this. So let's see where you go with this one. Where do you see stress? And just as kind of some background, we had Kelly McGonigal on talking about the upside of stress, and I'm curious about how how best to communicate that as coaches are talking to folks, and it obviously comes up in conversation all the time, but how are you approaching that, and what might be one little tidbit that you can build on the first two?
Love that. Love Kelly McGonigal's work. I've been following her for years. In fact, I'll throw it out right now. Something that, because you said her name. So she did a really interesting study, in fact, on stress reduction with yoga and binge eating with women. It was a relatively small study, but it was very interesting because it was about, if I'm remembering correctly, so this is hard because I'm just pulling.
Yeah, we're making it up. We're grabbing it as we go.
Yeah, so don't quote me exactly on this, but about 8 weeks, okay, intervention. I'm pretty sure it was about 8 weeks. And it was 60 to 90 minutes of yoga with postures and breathing. And it was self-report on mood, binge eating, and self-compassion. And by the end of the intervention that Kelly McGonigal was in charge of, the binge eating went down. Body image went up. Self-compassion went up. So there's a lot to stress reduction techniques like yoga. It doesn't have to be yoga.
Sure.
Mindfulness-based stress reduction. There's meditation. It doesn't have to be transcendental meditation. There's a relaxation response with Herb Benson here at Harvard. There's John Kabat-Zinn's mindfulness-based stress reduction. And all of these have been studied in terms of how they impact our brain. So I'll just take Sarah Lazar's work at Harvard at MGH, where she looked at meditators, people that meditate for a long time versus people that don't meditate, and then did MRIs and looked at the cortex, the prefrontal cortex thickness. Those that were meditating had thicker prefrontal cortex. And this went all the way up to older individuals, meaning 60s, 70s. So that was fascinating. So what's my point with stress reduction? So with yoga, there's data that shows that it can help us in many, many ways and can help with some very, very difficult situations, such as binge eating. There's a couple studies, I won't go through all of them with you, but the couple studies that show also it can reduce cortisol levels, can increase salivary IgA, which helps, it's in the mucosa, it helps with fighting infection. So yoga in itself, we know, yes, people say, oh, do yoga, it helps you. We know physiologically now what it may be doing, why it may be helping with that lowered cortisol level, but also that increased self-compassion, so important. And then with the meditation, I talked about exercise changing the brain. Well, guess what? You just heard that meditation may change the brain too. Not to scare everyone, but the last thing I'll say on this stress pillar is there's data, and it's not from yesterday. It's from, let me think, I believe it's 2015 that I'm pulling up an article in my head right now. I'm looking at this graph in my head that talks about chronic stress and its impact on the brain, the neurons, and the hippocampus. Chronic stress can actually have a negative, deleterious effect on the hippocampus. So if you're saying to yourself, oh no, I have been stressed, what about my hippocampus? What's the answer, Brad? There's an answer to that.
Get moving.
Yes. So don't worry, because I also gave you the solution. So you can stand up right now. You can start walking. You can take a walk out in nature later. You can get on a physical activity routine and enhance your hippocampus. All right. Next one.
You're killing it. You're killing it. Okay. So sleep, you've touched on this a couple times. Huge, just a little background on sleep. So when Suzanne and I first got married, we were married almost 31 years now, 30 years. And I had this ridiculous goal at the time of, honey, I want to train my body to be able to wake up at 3 something, because think how much I could get done. And this was in 93. So not as much data out at that point. But now if you say to somebody, oh, I'm only going to get 4 hours of sleep, you look at them and go, you're an idiot then. Like, that doesn't make any sense. You're functioning at 60% of capacity. What is something about sleep? We've had a lot of wonderful sleep guests on. Josie Brizard, Mita Singh, Dr. Winter was on a couple months ago. But what might be something that gives some people a different thought about sleep than maybe they looked at in the past?
Beautiful. Okay. Here's one for you. Do you know about the amygdala?
Again, vaguely. So dial that in for sleep for me.
Yeah, that's what I was hoping for. So great.
I passed.
Yeah. So the amygdala. No, this is exactly, again.
I mean, it's your monkey brain.
So the amygdala, part of that limbic system, really responds to threats. Right? And people can have what's called an amygdala flare, where their limbic system, specifically the amygdala, is taking over for the CEO, the prefrontal cortex, the cortex of the brain. And so everything is emotionally charged. You may have been in front of someone that's having an amygdala flare, and how would you know? Because you say something to them that's rational, and they ignore it, and they continue on in this, I can't believe you did that. That is just so ridiculous. You did that. You did that. You did that. You did that. Oh, you did that. You did that. You did that. And you're saying, sorry, what? Like, I didn't do. It doesn't matter, because their amygdala, even if you're saying I didn't actually fact, doesn't matter. The amygdala has flared so that they can't take in any rational thought, really, and they're just going to keep going. So this is uncomfortable. First of all, I have to share with you, right? It's uncomfortable for the person having the amygdala flare. It's no fun to be like that. No one likes to be like that. No one chooses to be like that. And it's also no fun to be on the receiving end of the amygdala flare. So when you're sleep deprived, you're 30% more likely to have an amygdala flare. What? Who wants an amygdala flare? So if you want to have nice relationships, if you would like to be productive, creative, engaged, have a joyful existence and day, you're going to want to sleep to allow your prefrontal cortex, the CEO of your brain, to be open, engaged, involved. And if the amygdala gets a little tweaking, if it gets a little fight, flight, threat happening, you can talk it down. You can say, all right, wait, let's start asking.
Right.
Let's start asking questions before pointing fingers and starting on the flare. So with sleep, we're able to have a brain that will be more collaborative, open, and joyful. Be able to find productive ways out of difficult situations. Sleep is important for heart disease, diabetes, high blood pressure, weight. So last tidbit on sleep will be, how familiar are you with ghrelin and leptin?
Know the terms. That's about as far as I go.
So perfect. Terrific. So people need to know that you can be on a diet. You can be, quote unquote, I don't even like to use that. I try to help people enjoy healthy eating patterns.
Yeah. Choose better versus avoiding bad in quotes.
I guess like eating patterns, like dieta, it's a Greek term. It means it means lifestyle. It means living. It doesn't actually mean restricting food, which is what diet is. So anyway, you may be enjoying a healthy eating pattern. You may be exercising, and then you may actually find yourself binging on potato chips and other things in a morning after you haven't slept well. Well, research tells us that's what happens.
Absolutely.
Haven't slept well, you veer towards those hyper palatable salt, sugar, fat layered on top of each other. And now research shows us perhaps why. Well, ghrelin increases our hunger. Leptin increases satiety, keeps us lean. I think of ghrelin as the gremlin, going to eat everything. Leptin as lean, right? So when we are in a good position with sleep, meaning we have restful sleep, high quality sleep, 7 to 9 hours of sleep, these hormones are in balance. Without 7 to 9 hours of quality sleep, feeling rested, not just being in the bed, lying there saying, I better be in the bed with my eyes closed, like this is sleep. No, actual sleep, right, for 7 to 9 hours. If you don't have that, ghrelin goes up, leptin goes down. So we are hungry. and we don't get the satiety signal. So sleep is essential. Well, for our mood, like we just said, and
for our neighbor,
for our neighbor, and then for our own self and our own eating patterns. Okay. Uh-oh.
Okay. So yeah, you've given me two. So first of all, and I should stop the recording here so we can start this business on the side. We need to consult with Elon Musk about his Twitter stuff. And it sounds like we could create a new medical screening based on what people are doing with their Twitter comments. If you provide too many negative statements to other people's tweets, Twitter should signal you that you're not getting adequate sleep and it's time to shut Twitter down or something. So there's our business idea. And then I think you need to get with the next presidential debate teams and get them to ask the question about their sleep, because it sounds like to me, all the politicians out there on both sides of the aisle are going off the rails with this amygdala issue, and their CEO is far from in charge. So maybe we need to get the debate questioner to add that question in, and then we can vote based on that.
How much sleep did you get?
Exactly. And we want 7 to 9.
Too funny. So with social connection, what is really interesting is back in 1979, Lisa Berkman was in California, and she had a colleague, Syme, and they did an interesting study of adults in Alameda County, followed them for 9 years, and just looked at their social connection network index. So how many people they connected with each week, if it was a close connection, if it was an organization, if it was a work related, if it was spiritual, what they were connecting and who they were connecting with and how often they were connecting, gave them a social network index. Okay. Meaning, are they socially connected?
Sure. Right. And it comes down to it. Right.
And then just stratified them because of all the questions into high social connection, low, and then middle, right? So she had various degrees of being socially connected in this research. By the way, she's now here at Harvard, still doing the same kind of research at the School of Public Health. At any rate, she was in California at the time. 1979. And then they looked at all-cause mortality for men and women in all age groups from 30 to 79. So they split it up. I think it was 30 to 39, 40 to 49, something, I don't know, 50 to 50. They split up the age groups, men and women. Didn't matter what age group, didn't matter what sex. If you had the highest number of connections, the highest social network index, so you were connected internally with your family as well as with other groups, you were the least likely to die, no matter what decade they looked at. That was 30-year-olds, 70-year-olds. So we have known being socially connected is important for our well-being, our longevity for a long time. And it is now being honored since COVID, right? COVID happened. I used to have to knock this pillar, on the door multiple times to get that door to open, right? To talk about social connection. Not anymore. Now medical groups are asking me to talk about social connection, because how do you create a high quality connection? That's the question. And how do you help your patients create high quality connections?
And it's different for everyone. What's high quality for Susanna is very different than high quality for myself and probably for you. And how do you address that? How do you help someone self-assess? Any thoughts on that? Someone who says, well, I've got tons of friends. Well, maybe it's still not really a connection there. Or like, is there a process that you can walk us through 10,000 foot view of how we can self-assess where we're at in those three general categories, if you will?
Yeah. So I love research, and Dr. Jane Dutton loves high quality connections, and she spent her career studying this. So this is her work. She has a great book. I think Connections at Work. I'm forgetting Jane Dutton, though. I know her work. I can tell you that. And she has 3 important aspects to a high quality connection. One, it has high emotional carrying capacity. That means that you express both positive and negative emotion, and you have safety in doing so. You use psychological safety. You can express when you're sad. You can express when you feel hurt, disappointed, frustrated. can express these. You also express when you're happy,
Sure.
when you're grateful.
But you have the freedom to.
Right. And it's high. You have high emotional carrying capacity. The second one is it's a generative relationship, which means you have the ability, it's resilient. You have the ability to bounce back after setbacks because no human being is perfect. We say things, we do things, maybe we're sleep deprived or something, right? So there are going to be mishaps. Of course, there's mishaps in life. No one is perfect. And we have the ability to bounce back. So we have mutual high regard, the person in the relationship that's a high quality, we're mutual high regard. And then when something happens, we take a growth mindset, Carol Dweck's work, and we figure out what happened. Sorry, it hurt. How was it that it hurt? Okay, I will do whatever I can to not do that again. And I apologize and I forgive, and we can move along. We can be resilient. Then the third is we embrace this generativity and we deflect behaviors that squash generativity. What does that mean? So if you think about it, your listeners are probably thinking, what behaviors squash growth in a relationship? What behaviors will make people, I guess, uncomfortable, make them want to hide, run away, get out of a relationship, no longer connect? So what do you think? What behaviors do you think?
I mean, the critical nature is a turn off, big for me at least. What else? Lack of availability. Just proximity matters. There's no doubt about it. Quality and quantity matter. Commonalities. So whether it's sporting events or faith groups or activities, the lack of those makes it difficult to have that connection. I guess those would be the ones that come to mind off the top of my head.
Because Brad, you're so compassionate, kind, and these things that I'm going to list, which are the things that people do, not you, I'm sure, but that people do that will squash growth in a relationship. Okay, here we go. Threatening, bullying, lying, silent treatment, say one thing, do another, gossip, going behind the person's back. These are huge. And
so basically being mean.
I would say disrespectful.
Yeah.
Mean, harassment, all this. These things will squash the relationship. So Jane Dutton has done a lot of work, and you can read more about that. But that's my answer to you for how we cultivate what she put forward. And I use it, her term, high quality connection, HQCs, she even says, but high quality connections, these deep connections that we want with others. Now, by the way, we can't have a high quality connection with everyone in our lives, with everyone in our workplace. It's just not possible. But we can all get along, and we know about getting along and being respectful and honoring the other individual. You don't have to go deep into conversations with everyone that you disagree with.
Yeah.
It could just be a disagreement and we move along. But if we're going to have a high quality connection, we need to work through this disagreement in a respectful, honorable way with these three pieces in place.
We need a lot more of that. All right. I'm watching the clock. Are you doing okay if we go another 5-7 minutes here?
Yes, I think we can do another. Yeah.
Okay. So chronic pain influences a high percentage of people. I think a lot higher. I come from a physical therapy background, so I've seen it in that realm. But I think a lot of us don't realize who's suffering with chronic pain. I heard your interview on the role of the mind in this area of chronic pain. Can you share some of the key aspects around this and maybe some options that are available to those who are struggling with that or know someone that maybe they haven't considered in the past?
This is an important topic, Brad, chronic pain. So many people day in and day out are living with chronic pain, and they're searching for answers. Now, this is multifactorial, so the solution will be multifactorial. And I would recommend that everyone see someone who specializes in chronic pain. You need your own specialist in this regard. I am not a specialist in chronic pain. I know about lifestyle and lifestyle medicine and how each one of these pillars can have an impact on pain and pain sensations. That does not mean if you follow these 6 pillars, you will get rid of it.
Absolutely. Absolutely.
I mean, it could be stretching from contractures. It could be completely multifactorial. But what I learned that was quite powerful, and I learned it in my own training in 2014, so almost a decade ago, with mindfulness-based stress reduction. I mentioned this with John Kabat-Zinn. I took a CME course to get trained in a 5-day intensive. And I learned about the power of the breath and focusing in, taking a deep breath in, deep breath out, non-judgmentally, just focusing in on my breath. Other thoughts would come in. I'd say, that's interesting. Just like John Kabat-Zinn said, here's some other thoughts. And he would always say, it happens to me even, and I've been doing this for years, he'd say. And then I just say, that's okay. Those are those thoughts. No problem. Back to the breath. It just meant you needed to just say, oh, back to the breath. And then he would, maybe if you like, you add a mantra in. For me, loving kindness in. I learned it from him a decade ago. I love it. Loving kindness in, loving kindness out, loving kindness. And so I would just work on this and breathing. I do this also with clients. I'm open to this. I don't make anyone do this. You can also do the relaxation response. You can do 4-7-8 breathing. You do a number.
Sure.
But this resonated with me. I started using it when I had pain, different kind of pain. Chronic pain is interesting and varied. My mom was living with me and she had dementia. And I had my teenage boys and my husband and the dog and the books and the lectures and the clients. And I was Wonder Woman, going to just take care of everyone. And it was hurting. And when I went to this mindfulness-based stress reduction, because I found it on PubMed, what's the best thing for caregiving of people with dementia? And it came up, MBSR. So as it turns out, MBSR has also been shown, as John Kabat-Zinn shared in his group, and I have seen in the literature, also been shown to help people reduce pain. Now, this is not for everyone. And with any kind of slowing of the mindfulness-based stress reduction or meditation, some people with chronic pain, it can make it worse. It's psychological pain, physical pain. This quieting and this focus on the breath can actually make it worse. So this is the N of 1 investigations. We try. If it doesn't work, it doesn't work, and that's okay. But there's a lot of data that shows that it does. And chronic pain specialists do recommend to many of their patients, not all, many who are interested, to go to the mindfulness-based stress reduction courses and to learn how to do this because it can be so powerful in reducing the sensation of pain and controlling it. So it is something that I personally like to share. Now, I don't know if you and your wife have kids. Do you?
We do. All 3 adult kids within 45 minutes to an hour, and all 3 are married right now.
Isn't that great? So
it's amazing.
It's beautiful. And they may be having kids. Now, many people.
We have our first grandchild about 20 days ago. So yes, quite exciting.
So exciting. So we know childbirth is painful. We know that. And we've also known, and some of your listeners will have experienced natural childbirth. And that's some severe pain that is managed with the mind. And I was in New York City, go, getter before my kids. So when they told me that you could do this, it was called Lamaze classes. My first was born in 99. I thought, oh, that sounds nice, but like, how, I don't see this. And I did the research on it. Then I did research because I love to look at the research. That's what I like to do. And I saw that it could really help. And then I thought, well, I'd rather do this than take personally. Everyone.
Sure. Yeah. Absolutely.
We all make choices and the choices are the right ones for the person making it.
Absolutely.
I was choosing that I wanted to try to do this naturally. So I went to these Lamaze classes and I practiced and I had my mantra. I had my image of the beach and the waves and the sun, just so, and walking with my husband and a little baby in between us. And we were walking on the beach and there it was. And sure enough, time to give birth. And sure, that was painful, but the mind went to the beach, with every contraction. There was the wave, just rode the wave, and had natural childbirth both times. And I think that when you've done that, you understand that the mind is an incredible thing. It can't erase all pain. And by the way, I only had to go through that for a few hours. People have chronic pain for years.
They don't know where the end point is. You knew where the end point was, right?
Bingo.
Exactly.
Bingo. But the main point being that our mind is so powerful. So if in some points of the day we can quiet it, get it into a mindfulness-based stress reduction state or relaxation response, or just a place where we can take some deep breaths in and out, that's really a wonderful place to be. If we can get there. Yeah. Look, people with chronic pain, like I said, the first thing is get yourself a really good specialist, right. and then consider if you can get beyond the real intense pain that may be happening from an accident, from an injury, from I don't know what. Yeah. Then we can move on to these other strategies that have been shown in literature to help.
This is so good. My PhD work was in something called functional mental toughness. So you are singing my song right now. So good stuff. We could talk for hours. Let's wrap up with this final one. We call it the catalyst calling. And a catalyst, for those that are like, I don't even know how to spell it, let alone what it means. That's someone who's able to create positive change. In chemistry, it was the thing you put into those two chemicals and they wouldn't mix fast enough, or they wouldn't mix at all. So you throw a catalyst in there and things start to happen. But the catalyst doesn't get used up. And that is so critical to our mission as we help people make a difference, but not a martyr difference, a difference that grows you in the process. So last question with that little precursor. What is Dr. Frates' catalyst calling? What's that thing that fills you up while you're making that positive difference? You're not making the positive difference at the detriment of you and your life. You're making that positive difference, and it actually fills you up even more.
Mm-hmm. Mm-hmm. A lot of different ways to go with this, but what I keep coming to and what keeps calling me is that ultimately it was really the love of family that got me into this. My dad, we were a tight family. Mm. It's tight with his parents. My mom was tight with hers, who immigrated from Greece, and watching him go through that hardship of being paralyzed. He did regain function, and he did change his life and make a complete recovery and lifestyle change at the same time. But I think it's that, oddly, I was going to go work with him. I was going to be the third generation of Pegs, that's my maiden name, to take over my grandfather's company on Park Avenue that was financial advising, tax accounting. And I was the youngest Peg, and everyone, because I was hardworking, quiet, and nose to the grind, it was always Beth.
She's the one.
She'll do the hard work. She'll grind it. And I did want to work with my dad because I admired him. I liked math and I liked helping people, and I wanted people to get mortgages and send their kids to college, and the things he would talk about that, he was able to help people do. And then it was after his heart attack and stroke, he changed completely, and he worked much less, but it opened me up to this area of helping others so that didn't happen to them. And I always want to work with him. And it's just strange because he is now since this and since his event, and I've dove deeply into this area, I am in a strange way working with him, even though he has passed away. He lived 27 wonderful, beautiful, best years of his life after the heart attack and stroke. But I think what keeps me going is that if I can today, somebody heard this and they're now going to start sleeping more and honoring their sleep. So we know their glucose will be better controlled and they'll have less chance of getting high blood pressure and heart disease. So if I feel every day that in this interaction, one person learns something that will help them avoid that mishap, that health setback of a heart attack and stroke, then I'm doing my job. And just sometimes someone will email me. I tweeted something. Someone will respond, then it will be so deep for me because it just says, okay, so I'm helping in some small way. To me, it's just helping in some small way.
Right.
Student who connects with me from 10 years ago to say what they're doing now and how what I said 10 years ago had an impact. I mean, this is what fuels me, just that I may be helping somebody today, tomorrow, or I did yesterday.
Beautiful. Dr. Frates, really appreciate it. Thank you for taking the time, a little more time than I originally asked you for. So thanks for giving that to us, and wonderful stuff. We could go for many hours, but really appreciate your time.
Thank you so, so much.
Thanks for tuning into the #1 podcast for health and wellness coaching. We've just come off the biggest single month of downloads in our 5-year, 260 plus episode history. We have you to thank for that. So thank you for sharing the podcast with those you're around, whether it's peers, friends, coworkers, coaches, clients. We are now just a whisper outside the top 1% of all podcasts. So seriously, thank you for making that happen. It means a lot to all of us. And now it's time to be a catalyst. This is Catalyst Coaching 360's Dr. Brad Cooper. Make it a great rest of your week, and I'll speak with you soon on the next episode of the Catalyst 360 podcast, or maybe over on the YouTube coaching channel.